Yeah. Elissa Samaha.
مبالشين غلط.
I'm not sweating because of you. I'm sweating because I moved from one side of the room to the other 20 times with one foot on this chair to make sure that this looks okay. I'm very excited to do this with you. And I'll say why. You're the only person who's seen me change in the last 3 weeks. And the first time I met you, I was on a stretcher. I was being ruled in, and I had no idea where I was going. And I was barely awake, and I think you're the first face I saw downstairs. And you saw me in my weakest state. Now look at me. I can put my own clothes on. It takes 1 hour to do this, but I did it. I took off a lot of my, I don't know what they're called, the things that cover your wounds and your scars. I feel better. I'm physically better. I'm mentally happier, and I owe most of that to you. So I wanted you to know this. This is my way of thanking you. So I'm a bit emotional.
And I'm proud of you.
Thank you. The moment I knew I was going to enjoy physiotherapy is when you encouraged me to stand up for the first time. I had not stood up for a week, and I could stand for maybe 20 seconds. But you were there, you were very supportive. I think most of my sessions have been with you.
It's true.
Yeah, so I want to get to know you a bit. How would you describe yourself? I know you're professionally a physiotherapist, but how would you describe your relationship to this work to somebody who doesn't really know you well?
Okay, so my name is Elissa. It's been like 2 years I'm working at the hospital. And I love my job. I'm actually currently doing my doctorate in USJ. Next year I'm gonna graduate very soon يعني. And I actually love my job يعني. I love helping people. I love doing what I do best يعني. And sometimes it's hard لأنه people don't really know what physio means. يعني بفتكر لو you didn't do your injury and هيك you got to know better what physio is, you wouldn't understand how much it's deeper than only just standing up or moving. I don't know, strengthening your muscle. It's mentally, physically exhausting. We help a lot of people. You saw a lot of cases at the hospital. يعني. I don't know what to talk about myself really, but you know, I love what I do. And
But I'm glad you actually said something which I didn't think about. What exactly is physiotherapy? I didn't really know what it was until I got into it. Now I feel that it's much more than exercise.
Yeah.
But how would you define physiotherapy?
It's not just a recovery after an injury. It has a lot more هيك little branches. I don't know what we can say it يعني بس
And you can also speak in Arabic anytime you want
Okay.
to. It's totally fine.
Okay.
Yeah. It's not French.
Okay,
I
not
will
French.
I will not
okay.
understand what you're saying.
I know that.
Yeah, exactly.
I knew that when I spoke to you in French.
Thank you. Yes.
Like you know, I'm from. I study in
100%.
USJ.
Yes, that's true. Yes.
Okay, so it's more than that. يعني. It's not only injuries. People who have stroke, recovery, we help people get their mobility, flexibility, balance. We work on vertigo. We work with patients who are paralyzed. يعني there are a lot more than just physio is massage. You saw us, يعني, saw how we work.
Yeah.
We do everything. And people usually go to إنه هيك relaxing. They like this treatment. While you know best now, movement is key. When you work hard, you strengthen your muscle, you work on your mobility, you work on your flexibility, balance. This is what helps you most, usually.
My relationship to physiotherapy is, in many ways, my relationship to you. I met physiotherapy when I met you, so I associate it with you. I've never felt that it was massage focused. On the contrary, it feels like it's physical activity,
It's true.
and sometimes I enjoy it because it means that I'm
Challenging yourself.
yeah, and I never felt it's a way of sort of relaxing. On the contrary, it's challenging. You entered physiotherapy, I guess, if I'm doing mathematics here, you studied physiotherapy from day one. It's not like you switched majors or...
No, yeah.
Because I'm assuming doctorate at your age means you studied from day one. Why did you choose physiotherapy? I know maybe it's a silly question. I'm sorry if it's silly.
No, it's not actually. When I was young, I didn't know what physiotherapy mean. Yani. I didn't really understood what does this major do. Yani. Usually, we understand physiotherapy equal massage. Actually, it's a funny story. I don't know if I can share.
Did you injure somebody and then have to give them physiotherapy?
No. I don't know how we can call it, but when I was in school, there was هيك forum de métier. I don't know if you can هيك يعني work like it's a forum that we can see everything يعني every major.
Yeah, like an open house. You see
Yeah. And there was this guy who came very quickly, who has been late to everything, and هيك wearing a suit and coming from an interview. Look, I'm doing an interview. And he told us, he's a doctor, he did physiotherapy. And I thought, wow, doctor, physiotherapy, suit, interview, this is it.
That's it? That's all you needed? That's funny.
Actually, okay, أكيد I love helping people. This is a sacrifice when you're into physical therapy. It's everything related to humanity. You talk, you share memories, you feel the patient, but at the same time, this is not how how I chose.
Oh, so it's not related to why you chose. Oh,
no.
Okay.
Actually, I chose my major.
So you came across something that you thought was interesting, and you ended up enjoying it on the way.
Yeah.
Okay.
Yeah. It wasn't. I didn't know what I was getting into.
Yeah. I think that's in a way you're lucky. A lot of people regret. It sounds like you did the opposite. You chose by chance, and now you're doing it for a living. A doctorate is not easy in any profession, in any major, sorry. I'm curious why the doctorate is something you're pursuing when you can already do physiotherapy downstairs. What's the advantage? Is it that you can teach physiotherapy?
Yeah,
okay.
I can teach, and it's important to always continue. There is always something new. Even if you can see, my age and the physical therapists that are my age and the older ones are not the same. We don't use the same techniques. Everything is evolving, so you have to keep up with everything. So that's why mainly I chose, and it's important to always research to not only doctorate, and if I wasn't doing my doctorate and I was doing everything else, workshops, anything.
But you're able to work without doing that. You're already practicing.
Yeah. I'm able.
So this profession, and I'm going to tell you the way I've seen it, and you can sort of tell me if I'm right or wrong. I think a lot of it is psychological too, because downstairs, everyone is very supportive. There's no one making me feel uncomfortable. Everybody is, and actually, for me, that's the difference between what I went through in the hospital, which was a lot of chaos, a lot of survival technique. Here, it seems to be more, now it's recovery and making sure you get better. Is that a right way of looking at physiotherapy? That there's a mental health angle to it as well?
Yeah, a lot. It's important, we usually say that, even though I'm angry or sad, I put everything away.
Yeah.
I focus with my patient because it's important. Now it's your time.
Yeah.
And I need to help you be your best, do your best. قد ما في يعني short time قد ما في بوقت قليل.
Yeah.
So this is what's really important, and it's important to keep pushing, keep helping. لأنه it's not easy. It's not easy for you. يعني you remember what I told you the first day I saw you?
I don't remember much from the first
Okay,
day. Other than I recognized you the second day. I'm like, oh, that's my physiotherapist.
قلت لك بدنا نطول بالنا لأنه it's a very long procedure.
Yeah.
And even though you're getting stronger, sometimes I know إنه هيك you can feel إنه خلاص sick of it. إنه يلا I need to walk, I need to get back to life. إنه it wasn't easy to put a shirt on.
It's the first time
It's the first time, and bravo, I'm happy.
I wanted to look good for that episode. I really wanted to look good. I wanted to impress you. I think that's part of it, though. What you guys do downstairs is that you get us, you got me motivated to show you that I'm improving too. But that's psychological. That's not really that's not physical. It's motivation.
It's both.
Yeah.
يعني you can see يعني the progress is thin with both. عندك mental and physical. If you're physically good but mentally you don't want to get up, you don't want to move, you don't want to walk, you don't want to هيدا أكيد you're not gonna do anything.
Do you find that there is a range of patients that sometimes don't want to make the effort?
Yeah.
How do you handle that kind of patient? Because I'd like to think that I'm interested in doing as best as I can. But I'm just wondering what it's like for you to push somebody who's not in, maybe they're suffering too much. Mm-hmm. How do you handle that?
Sometimes it's out of our control. يعني sometimes we're helping a lot, we try our best, we motivate, we talk to the family, we try يعني to do anything that could help the patient, but at the end كمان sometimes we ask a psychiatrist, a psychologist.
Yeah, so yes. That does happen sometimes where you need additional support.
Yeah, of course. It's not easy. It's not easy at all. And sometimes عن جد people don't want to believe that they can.
Yeah. I think physiotherapy requires individual motivation too, but I'm new to it. I'll tell you that before I had my injury, I did not know what physiotherapy really was. I never imagined going to a rehabilitation center. I never imagined meeting a physiotherapist professionally. Maybe socially somebody would say it. And I thought, and I'd like you to tell me if maybe you can help explain why I didn't understand something. I thought you don't need physiotherapy.
Everyone, yeah.
Yeah, and why is there that misinformation? I thought you can avoid physiotherapy and you heal on your own. Is that common?
Yeah, it's really common. It's really common. Sorry.
Taking my leg.
Sorry.
Injure me? Yeah.
Sorry. هلا بعمل لك فيزيو بكره.
In bed, I'll do what you taught me. Remove your toes one by one.
Yeah, it's really common actually, and honestly, it's really sad. لأنه usually you go to a physical therapist when خلاص you can't anymore, you cannot tolerate the pain anymore.
Yeah.
It's a chronic pain بتصير إنه okay, so it's a chronic pain, but we need to help you heal. يعني it's the last resource that they come to a physical therapy session يعني. And actually physical therapy you can do it هيك for recovery.
Yeah.
يعني if you practice مثلا any kind of sports, you can do once a month a physical therapy recovery session. You can work on your flexibility. You can avoid any injuries. This is how it helps. يعني this is the misunderstanding.
But what happens if let's use my example.
You skip?
Let's say, because you've gotten to know my injury well. I have 3 injuries. Shoulder, knee, and leg. At Hotel Mgr, they said you have to go to rehabilitation. You'll need physiotherapy for a long time. Let's just say I said no. What would my body end up looking like? How would I feel? And what are the consequences of not doing physiotherapy?
There will be consequences.
What exactly would that be? Is it that I would not be able to move?
Your hand, maybe you will have a frozen shoulder in your hand because it's always close to your body, and you're always putting the attel on your hand. Your leg weakness, imbalance.
So the body would not heal on its own, or at least it wouldn't.
Will help. Yeah, of course it will. And even though you would stay at home without doing any exercises for your leg or your arm.
It's all new to me. So I assume that you need to do something, but physiotherapy is more, it's
structured.
It's a bit disciplined too.
Yeah.
So what would happen? Let's just assume I didn't do the leg lessons.
Weakness in your leg. You will not be ready when you want to walk to do your first steps.
I see.
This is the first thing. How you will know your pain limit in your arm? Yani when we do them, we mobilize your arm. How would you know when to stop? When you should work? What muscle you should work on? The key muscles. You remember?
But so you're customizing it. In other words, you get to know the patient, and then you're able to see their unique limits.
Of course.
If I didn't do physiotherapy, would there be risk of permanent damage?
Not permanent, but it could have a lot of damages. Honestly. محل ما to heal in ما بعرف 6 months, يمكن it would take you a year and a half.
Right.
Why? Because I did not work on my strength, I did not work on my balance, I did not work on the key muscles, I did not work on the mobility of the shoulder. And you know how important it is to use your hand.
Now I respect physiotherapy. I had no relationship to it before. I thought physiotherapy is only for injury. You're telling me that it's actually for, in general, you should do it if you're active in sports. I didn't know that. So it's recommended if you're active in general.
It's a recovery session. Even though you do not have anything, you're not injured, you do not have any pain, you can do a recovery session. Your muscle needs the recovery. Even though you don't do sports, by the way, you don't practice any kind of sports, you can do recovery. Because every day you're driving, there's stress, you're just sitting, you work all the way on all day on your laptop. It's stress. Everything.
Does the physiotherapist ever need physiotherapy?
Of course.
There was one day I thought you needed physiotherapy because you did exactly what you said earlier. You were very focused on the patient. You didn't let your personal life impact your professional life. But you came to work with a spare tire. Your tire blew up on the way coming to work, and you were still in a good mood. You were talking like nothing happened, and you were able to do a full session. I think, it takes a lot of work. But then you need physiotherapy.
I do.
Right. That makes sense. So let's talk about me. I don't want to. I know it sounds selfish, but I think it's okay.
Okay.
Because. And that's the only reason I know you, is that you've been helping me. How do you see my progress from day 1 to day 15?
Actually, I'm happy that I got the chance to work with you, honestly, and I'm saying this. It's been great. I'm not gonna talk about your progression only. I'm gonna talk how mentally I saw you evolve. عن جد from the first time till now. I'm enjoying the session with you. I'm happy. We got to share laughs. At the same time, we're working hard. We're doing what we need to do during this session. I'm happy, honestly. I got to see your progression. I know we still have a lot to work on, but I believe that you're good. You work hard. You're a hard worker, honestly. You're pushing through your pain. كل ما أسأله, you have any kind of pain? No, I'm okay. بيكون هو.
But that's because of you. I'm encouraged by you to handle it and try.
So لا عن جد you're doing good. يعني from someone who wasn't standing, who felt dizzy when he first stood up, and now لا, you're doing good, your muscles are very good, your mobility, the shoulder mobility is good also. We're still waiting for you to get the okay, for you to get our first, for you to get your first steps.
Yeah, I think that still takes
2 weeks, 2 to 3 weeks.
2 to 3 weeks to try to put pressure. Yeah. I'm glad you're saying this because you're the only person that would know. Nobody else has seen me every single day. So I'm happy you're saying that. This kind of injury, is this something you've come across before?
Yeah.
Where the whole left side? Oh, really?
Yeah,
So I did. Okay, so that where you lose all your left mobility?
There's one now coming.
Really?
Eh?
Here and
Yeah.
Wow.
Yeah, there's a patient here.
Okay.
Well, she has the same injury as you.
Okay. Wow. Was it a scooter accident?
Yeah.
No.
لا.
That would be too much. So then you've dealt with all types of injuries.
Yeah. I learned a lot here.
Yeah.
But it's really nice. It's interesting. It's scary. But it's challenging.
May I ask you, why is it scary? Is it from people's reaction?
No.
So what is scary about
It's
it?
challenging. You always needs to push. Okay, yalla. I'm gonna do my best to help this patient here. He's counting on me. You were counting on me.
Thankfully, I was counting on you, but you delivered too. And I've seen something too. You're good with all ages. There's kids, maybe 5, 6 years old. You're as professional with them as you are with me or an 80-year-old woman. I've seen all types of people that you're able to interact with them positively. I'll wrap it up with a question. So physiotherapy is one thing. Pursuing a PhD doctorate is something else very hard. Your hair.
لا.
I want to say it on the record. I'm honored to meet somebody who sought inspiration through my hair bands. You now have 2. One blue,
one black. Yeah.
These don't work for me, they work for you. I'm really
كان لازم
happy.
تجيبهم.
You should have, yeah. But I'm really happy. You know why? Because you're helping me recover my leg, knee, shoulder, and I'm doing something also equally important. Hair.
أكيد.
There's no laboratory for this. There's no rehabilitation. It's the perfect hairband.
Yeah, the perfect hairband.
That's small, but it works.
It works a lot.
I was so proud of myself when I got you the hairband. I'm like, she's given me so much, I can give her something in return.
كل يوم بيجيب لي واحدة. One blue, one black.
Yeah, we both have hair. We have to manage our hair.
Yeah, of course. كل واحد بطريقة.
That's true. I won't take more of your time. You were a stranger 3 weeks ago. You're a friend now. And you've helped me in ways you don't understand. I know a lot of people probably tell you this, but I think I'm mentally better now because of you.
Thank you.
Yeah, I can say that fully, with full confidence. You've been the secret to my recovery. So on that note, Elissa Samaha.
Wow.
Thank you.
Love the ending. Merci لك. Thank
Thanks
you.
to you.
I'm proud of you والله. عن جد.
You've helped me a lot.
لا. أنت you worked hard. Honestly.
Yeah.
عن جد إنه أنت لو ما أنت اشتغلت هالقد you work really hard on yourself mentally and physically حطيت هيدا الجول براسك ما كنت وصلت لهون.
I helped. You helped me too. You got me the Kinetech machine. You did. It's a mutual It's a collaborative effort.
Yeah, it's true.
But it can't be done alone. You need a physiotherapist.
Okay. هلا الأندينج.
That's We did it.
We did it.